Northern State Medical University, Department of Anatomy and Operative Surgery presents Anatomy of the Heart. The heart is a hollow muscular organ that pumps blood into the arteries and receives venous blood. Located in the chest cavity as part of the organs of the middle mediastinum, the heart is shaped like a cone. The longitudinal axis of the heart is directed obliquely from right to left, from top to bottom, and from back to front. About 2/3 of the heart is on the left side of the chest cavity. The apex of the heart, apex cordis, faces downward, left and forward, and the wider base of the heart, basis cordis, faces upward and backward.
The sternocostal surface of the heart, fascius sternocostalis, is more convex, is directed to the posterior surface of the sternum and ribs. The lower one is adjacent to the diaphragm and is called diaphragmatic surface, fascius diaphragmatica. The lateral surface of the heart faces the lung. Each of them is called pulmonary, fascius pulmonalis. They are fully visible only when the lungs are diverted from the heart. The average heart weight for man is 300 gram and for women is 250 gram. On the surface of the heart, there is a transversely located coronal sulcus, sulcus coronarius, which is a border between arteria and ventricles. In front, sulcus is covered by pulmonary trunk and the ascending part of the aorta, behind which arteria are located. Above this group, on the surface of the heart, there is a part of right atrium with its right auricle and the appendage of the left atrium, which lies entirely behind the pulmonary trunk. On the anterior sternocostal surface of the heart, the anterior interventricular groove, sulcus interventricularis anterior, is visible. The heart wall is made up of 3 layers: a thin inner layer endocardium, a thick muscle layer of myocardium, and a thin outer layer epicardium, which is a visceral layer of serous membrane of the heart, the pericardium. Endocardium lines the inside of heart cavity, repeating their complex relief and covering the papillary muscles with their tendon cords. The anterioventricular valves, the aortic valves, and the pulmonary valve, as well as valves of the inferior vena cava and coronary sinus, are formed by endocardial duplications, within which connective tissue fibers are located. The middle layer of wall of the heart, myocardium is formed by cardiac striated muscles tissue and consists of cardiac cardiomyocytes, interconnected by a large number of bridges with which they are connected into muscle complexes or fibers, forming a narrow loop network. It provides a complex rhythmic contraction of arteria and ventricles. The thickness of myocardium is smallest in arteria and largest in the left ventricle.
The pericardial sac, delimits the heart from neighboring organs, is a thin and at the same time dense, durable fibrous sac in which the heart is located. It consists of 2 layers, outer fibrous and inner serous. The outer layers are the pericardium fibrous, pericardium fibrosum, located near the large vessels of the heart. The serous pericardium serosum, has 2 plates, the parietal lamina parietalis, which lines the fibrous pericardium from the inside, and the visceral lamina visceralis, which covers the heart, being its outer shell, the epicardium. Between the parietal plate of the serous pericardium from the outside and its visceral plate, there is a slit-like space, the pericardial cavity, cavum pericardii, which contains a small amount of serous fluid. The pericardium resembles an irregular cone in shape, the base of which is tightly adhered to the tendon center of the diaphragm, and at the top it covers the initial sections of large vessels, the ascending part of the aorta, the pulmonary trunk, as well as the superior and inferior vena cava. In the pericardium, 3 sections are distinguished: anterior sternocostal, which occupies the area between the right and left mediastinal pleura; lower diaphragmatic, fused with the tendon center of the diaphragm. The mediastinal section is the most significant in length. from the lateral sides, and in front, this part of the pericardium is tightly fused with the mediastinal pleura. On the left and right between the pericardium and the pleura, the phrenic nerve and blood vessels pass. Behind the mediastinal pericardium is adjacent to the esophagus, the thoracic aorta, azygous and semi-unpaired veins surrounded by loose connective tissue.
The pre-aortic sinus is located between the aorta and the pulmonary trunk. The post-aortic sinus is located between the aorta and the superior vena cava. Pericardy. The transverse pericardial sinus. A sinus transversus pericardi is located behind the aorta and the pulmonary trunk. The oblique sinus of the pericardium, sinus obliquus pericardi, is located between the inferior vena cava, below and on the right, the left pulmonary veins, above a small space in the apex of the heart, the apical sinus. The skeleton of a heart is a connective tissue. The myocardium begins from it. The atrioventricular valves, the valves of aorta and pulmonary trunks, are attached to it. The right annuli fibrosus dexter is a site of attachment of right atrioventricular or tricuspid valve. The left annulus fibrosus, annuli fibrosus sinister, is the place of attachment of left atrioventricular or mitral valve or bicuspid valve. The aortic valve is attached to the fibrous ring of the aorta on the fibrous ring of the pulmonary trunk. The pulmonary trunk, right and left fibrous triangles, trigonum fibrosum dextrum, trigonum fibrosum sinistrum, are dense plates which on the left and right adjoin the posterior semicircle of the aorta and are formed as a result of fusion of left annulus fibrosus with the connective tissue ring of aortic opening. The heart consists of 4 chambers, 2 atria and 2 ventricles, right and left. The atria receives blood from the veins and push it to the ventricles. The ventricles eject blood into the arteries. The right half of the heart contains venous blood. The left half contains the arterial blood. They do not communicate with each other.
The right atrium, atrium dextrum, has an additional cavity, the right auricula, auricula dextra. The right atrium is separated from the left by the atrial septum, septum intraarteriale. On the septum there is an oval depression, an oval fossa, fossa ovalis. In the right atrium there is the opening of the superior vena cava, ostium venae cava superioris, and the opening of the inferior vena cava, ostium venae cava inferioris. Along the lower edge of the latter there is a small permanent semilunar fold called the valve of the lower hollow valvula vena cava inferioris. On the inner surface of the right auricula and the adjacent section of the anterior wall of the right atrium are the calm muscles, musculus pectinati. At the top, they end with a borderline ridge, crista terminalis, which separates the venous sinus from the cavity of the right atrium. The heart, or rather its ears, secrete a certain special hormone called auriculin, from the Latin auricula, an ear, which in modern literature is often referred to as an atrial natriuretic factor, which of course more fully reflects the functional components. Auriculin suppresses renin secretion, relaxes vascular smooth muscles, thereby helping to lower blood pressure. The atrium communicates with the ventricle through the right atrioventricular opening, ostium atrioventricular dextrum. Between the latter and the opening of the inferior vena cava is the opening of the coronary sinus, ostium sinus coronarii. In its mouth, a thin crescent fold is visible, the valve of the coronary sinus, valvula sinus coronarii. Near the opening of the coronary sinus, there are punctate openings of the smallest veins of the heart, foramina venarum minimarum, flowing into the right atrium. Right ventricle, ventriculus dexter, is located on the right and in the front of the left ventricle. Its slightly convex medial wall is interventricular septum, septum interventriculare, which separates the right ventricles from the left. In upper part of the ventricle there are 2 openings behind the right anterioventricular opening.
ostium anteventriculare dextrum, through which venous blood enters the ventricle from the right atrium, and in the front of the opening of the pulmonary trunk, ostium trunci pulmonalis, through which blood is directed to the pulmonary trunk. Right atrioventricular opening is closed by right atrioventricular or tricuspid valve. Valve atrioventricularis dextra in the inner surface of the right ventricle, cords protruding into the ventricular lumen are visible. Fleshy tuberculae carne, cone-shaped papillary muscles, musculus papillaris. Most of the tendons, cords begins from the top of each other of these muscles, anterior and posterior.
Atrium, atrium sinistrum, which has an irregular cuboid shape, is delimited from the right by a smooth interior septum. The oval fossa located on it is more pronounced from the side of the right atrium. The left atrium has 5 holes, 4 of which are located above and behind. These are the openings of the pulmonary veins, ostia venarum pulmonarium. They have no valves. The fifth largest opening of the left atrium is the left atrioventricular opening, ostium atrioventriculare sinistrum, which communicates the atrium with the ventricle of the same name. The anterior wall of the atrium has a cone-shaped extension facing anteriorly the left auricula, auricula sinistra. On the side of the cavity, the wall of the left atrium is smooth, since the comb muscles are located only in the atrial appendage. The left ventricle, ventriculus sinister, with the base of facing up. In the upper widest part of the ventricle there is an opening. Behind and on the left is the left atrioventricular opening, ostium atrioventriculare sinistrum, and to the right of it is opening of the aorta, ostium aortae. The right one has a left atrioventricular valve, mitral valve, valve atrioventricularis sinistra, valve mitralis. On the inner surface of the ventricle there are many large fleshy trabeculae and 2 papillary muscles, anterior muscularis papillaris anterior and posterior papillaris posterior, with their thick tendon cords attaching to the atrioventricular valve cusps. Before entering the opening of the aorta, the surface of the ventricle is smooth. At the very beginning there is the aortic valve, valva aortae.
Valves between atria and ventricles: right atrioventricular valve or tricuspid valve, atrioventricularis dextra. It consists of 3 valves: cuspis anterior, cuspis posterior, and cuspis septalis. Left atrioventricular valve or mitral valve, atrioventricularis sinistra. It consists of 2 wings: cuspis anterior and cuspis posterior. Directly at the beginning of the pulmonary trunk is the valva trunci pulmonalis, pulmonary trunk valve, consisting of 3 semilunar flaps: valvula semilunaris anterior, valvula semilunaris dextra, valvula semilunaris sinistra. The valva aortae, aortic valve, consists of 3 semilunar valves: valvulae semilunaris posterior, valvulae semilunaris dextra, valvula semilunaris sinistra.
The right and left atrioventricular openings are projected onto the anterior chest wall along an oblique line following from the external end of the third left costal cartilage to the sixth right costal cartilage. The left opening is located on this line at the level of the third left costal cartilage. The right opening is above the place of attachment of the fifth right costal cartilage to the sternum. The opening of the aorta lies behind the left edge of the sternum at the level of the third costal space. The opening of the pulmonary trunk above the place of attachment of the third left costal cartilage to the sternum. The valve of the pulmonary trunk can be heard in the second intercostal space to the left of the sternum. The mitral valve can be heard in the fifth intercostal space along the line of the parasternalis. Places of hearing of the tricuspid valve at the base of the xiphoid process. Aortic valve in the second intercostal space to the right of the sternum.
Conduction of a contractile function of a heart is carried out by its conducting system. These are typical muscle fibers consisting of a cardiac conductive myocytes richly innervated with a small numbers of myofibrils and an abundance of a sarcoplasm, which have ability to conduct irritations from the nerves of heart to the myocardium and of the atria and ventricles. Centers of the cardiac conduction system are two nodes: the sinus arterial node, Kissfleck node, nodus centralis, located in the wall of the right atrium between the opening of the superior vena cava and the right ear, giving the branches to the arterial myocardium. Arterioventricular node, nodus arterioventricularis, lying on the thickness of the lower part of the interarterial septum. Arterio Caudal-Dres, which connects the arterial myocardium with the ventricular myocardium in the muscular part of the interventricular septum. This bundle is divided into right and left legs, crus dextrum and crus sinistrum. The terminal branch of the fibers, Purkinje fibers of the cardiac conduction system, into which these legs are divided, end in the ventricular myocardium. Vessels coming out to the heart are called veins, and those coming from the heart are arteries. Regardless of what kinds of blood flows in them, arterial or venous, the largest arterial vessel of the body leaves the left ventricle. Aorta is located between the aortic semilunar valve and the ventricle. The pulmonary trunk leaves the right ventricle, which is divided into two pulmonary arteries. Semilunar valve of the pulmonary trunk is located between the ventricle and the pulmonary trunk. Four pulmonary enter in the left atrium, and the superior and inferior vena cava enter the right atrium, as well as coronary sinus of the heart.
The lymph bed of the heart walls consists of lymphatic capillaries located in the form of networks in the endocardium, myocardium, and pericardium. Lymph flows into the surface network of lymphatic capillaries located in the epicardium and the plexus of lymphatic vessels. Connecting with each other, the lymphatic vessels are strengthened and form two main vessels of the heart through which the lymph flows to the regional lymph nodes. The left lymphatic vessel of the heart is formed from the fusion of the lymphatic vessels of the anterior surfaces of the right and left ventricles, the left pulmonary and posterior surfaces of the left ventricle. It follows from the left ventricle to the right, passes behind the pulmonary trunk, and flows into one of the lower tracheobronchial lymph nodes. The right lymphatic vessel of the heart is formed from the lymphatic vessels of the anterior and posterior surfaces of the right ventricle. It is directed from right to left along the anterior semicircle of the pulmonary trunk and flows into one of the anterior mediastinal lymph nodes located near the arterial ligament. The heart receives sensitive, sympathetic, and parasympathetic innervation. Sympathetic fibers from the right and left sympathetic trunks passing through the heart nerves transmit impulses that accelerate the heart rate, expand the lumen of the coronary arteries. Parasympathetic fibers conduct impulses that slow down the heart rate, narrow the lumen of the coronary arteries. Sensitive fibers are part of the nerves from the receptors of the walls of the heart and its vessels to the corresponding centers of the spinal cord and brain. The upper, middle, and lower cervical, as well as the thoracic cardiac nerves, start from the cervical and upper 2 to 5 nodes of the right and left sympathetic trunks. The innervation of the heart is also carried out by branches from the right and the left vagus nerves.
Soviet anatomist Voriev studied and described the intra-organ cardiac plexus. 6 nervous plexus consisting of the cells and fibers are located on the epicardium in the different part of the heart. Their branches penetrate the deep layers of the heart wall, forming intramyocardial and subendocardial cardiac plexuses. The following plexuses are distinguished. The right anterior one is in the thickness of the anterior and lateral walls of the right ventricles, and the left anterior one is located in the thickness of the anterior and lateral walls of the left ventricle. The branches of these plexuses pass into the myocardial and the anterior section of the septum of the ventricle and atria to the vessels and endocardium. The right posterior plexus is in the posterior wall of the right atrium between the orifices of the vena cava. Sinus arterial node of the cardiac conduction system is innervated from it. The left posterior plexus is in the thickness of the lateral wall of the left atrium, goes from left to right down along the oblique vein of the left atrium from its innervated atrial ventricular node, atrioventricular bundle of the cardiac conduction system. The anterior plexus of the arteria lying subepicardially on the anterior wall of the both arteries and the nerve to their musculature and endocardium, as well as to the anterior part of the wall of atria and septa ventricle. The posterior plexus of the left atrium is in the upper part of the posterior wall of the left atrium, send the nerves it to the adjacent wall of this atrium.
The heart is in the chest cavity within the organs of the middle mediastinum. 2/3 of the heart is located to the left and the median plane, and 1/3 to the right. From the sides and partly in front, most of the heart is covered with lungs enclosed in pleural sacs, and a much smaller part of it in front is adjacent to the sternum and to the costal cartilage. The upper border of the heart runs along a line connecting the upper edges of the right and left third costal cartilage. The right border descends from the level of the upper edge of the third right costal cartilage 1 to 2 cm to the right of the edge of the sternum, vertically down to the fifth right costal cartilage. The lower border is drawn along a line that runs from the fifth right costal cartilage to the apex of the heart. It is projected in the left fifth intercostal space at 1 to 1.5 cm medially from the mid-clavicular line. The left border of the heart extends from the upper edge of the cartilage third of the left rib, starting at the midpoint of the distance between the left edge of the sternum and the left mid-clavicular line, and continues to the apex of the heart. In the atrium, blood flows from the veins to the right from the vena cava, to the left from the pulmonary veins. During atrial systole, the valves that close the entrance to the ventricles open and blood is released into the ventricles. As soon as the ventricles are filled with blood, the valves close, the pressure in them rises, and ventricular systole sets in. At this time, the valves of the aorta and pulmonary artery open and blood is ejected into them under high pressure. Then diastole begins and the heart muscle rests. Small circle of blood circulation begins in the right ventricle, from where the blood saturated with carbon dioxide enters the lungs for oxygenation. From the right ventricle, blood is directed into the pulmonary arteries through which venous blood flows. On the right pulmonary artery, blood moves to the right lung, and on the left to the left. In the lungs, the pulmonary arteries branch out into many small capillaries. In the pulmonary vesicles of the alveoli, gas exchange occurs. Carbon dioxide contained in the capillaries goes into the alveolar air and oxygen enters the blood. Here, combining with hemoglobin, it forms oxyhemoglobin. The blood turns into arterial and returns to the left atrium through the pulmonary vein, completing the pulmonary circulation.
Systemic circulation originates in the left ventricle of the heart and delivers the oxygenated arterial blood to all tissue of the body. From left ventricle, blood is thrown into the largest artery, the aorta. Arteries that carry blood into the heads and the arm departs from this arc. Further, the aorta goes down, and this part of it is called the abdominal aorta. In the chest cavity, vessels depart from the organs of the chest. In the abdominal cavity of the digestive organs, kidneys, muscles of the lower half of the body. As the distance from the aorta increases, numerous arteries branch out many times and become the thinner and thinner. Such small arteries are called arterioles. Gradually, the arterioles turns into the smallest vessels of the bloodstream. Capillaries, the exchange of the substance between blood and surrounding tissue takes place through thin walls of the capillaries. Through blood hemoglobin previously combined with oxygen. Oxyhemoglobin again breaks down into hemoglobin and oxygen. Oxygen together with nutrients penetrates the tissues. Blood plasma absorbs the carbon dioxide and waste products from the tissue and carries them away. As a result of this exchange, blood turns into venous. After the exchange of substance between blood and surrounding tissues, the capillaries through which venous blood is already flowing are collected into the more largest vessels, veins. As blood moves away from the capillary network, veins become larger and larger. Veins of the upper half body flows into the superior vena cava. The veins of the lower half of the body into inferior vena cava. Both veins carry blood to the right atrium where systematic circulation ends.
In addition to two main circles of blood circulation, large and pulmonary, there are third more or coronary circulation, which form the arteria that supply the heart itself. Consider the structure of the third circle of blood circulation. The third or coronary circle of blood circulation begins with two coronary arteries. Turning the heart over the front surface away from itself, bending the atria and pulmonary trunk, we see two coronary arteries, Arteria coronaria dextra and Arteria coronaria sinistra. They extend from the initial part of the ascending aorta, or another name for the aortic bulb, from its inferior expansion above the location of the vulva aortalis, that is above the aortic valve. The right and left coronary arteries lie sulcus coronarius. This is the coronary sulcus that separates the atria from the ventricles. The right coronary artery encircles the heart on the right side, and from behind it gives off a large branch of the ramus interventricularis posterior, the posterior interventricular branch. The left coronary artery has a fairly short trunk and quickly splits into two large branches. One of them lies in the anterior interventricular groove and is also called ramus interventricularis anterior, the anterior interventricular branch. The second branch, ramus circumflexa, and it gives above around the heart on the left side and is located in the sulcus coronaris. On the posterior surface, the main trunk, arteria coronaria dextra and ramus circumflexus, form an anastomosis from an arteria coronaria sinistra. It is direct connection without a capillary bed. We do not see it since it is in the myocardium. This is the first major cardiac anastomosis. The second is at the apex of the heart, where the ramus interventricularis posterior will be anastomosed from the right coronary artery and the ramus interventricularis anterior from the left coronary artery. Anastomosis is located in the thickness of the myocardium. Venous blood from the heart is collected in 5 large and also small veins. The largest of these are vena cordis magna. Veins do not have branches. They have tributaries. Because the veins collect blood at the periphery and go to the center, unlike arteries which have a trunk and branches and are directed to the periphery. Vena cordis magna collects blood from the anterior surface and apex of the heart. The sample shows the approximate location of the vein. Only a small part of it has survived. Vena cordis magna lies in the anterior interventricular groove rising up. The large vein of the heart encircles the heart on the left side and flows into the sinus coronarius. The next largest vein is the vena cordis media. The middle vein of the heart, which collects blood at the back and apex of the heart. It begins with small tributaries, then strengthens. It is clearly visible here. It is more blue in color, lie in the posterior interventricular groove and flows into the sinus coronarius. There are several more veins, the most significant of which are vena posterior ventriculi sinistri, posterior vein of the left ventricle, and vena oblique atria sinistri, which is absent on the preparation. Vena cordis parva, a small vein of the heart, collects blood from the right side of the heart. All veins collect in the sinus coronarius, which flows into the right atrium below the opening of the inferior vena cava. Inside the opening of the ostium sinus coronarius is a small valve, the valvula sinus coronarius or tabasium flap.
Arterial blood enriched with oxygen and nutrients flows from the mother placenta into umbilical vein, which enters the fetus at the navel and travels up to the liver, lying in its left longitudinal sulcus at the level of the gate of the liver. Umbilical vein is divided into two branches, one of which immediately flows into the portal vein, and other called ductus venosus reaches along with the lower surface of the liver to its posterior edge, where it flows into the trunk of the inferior vena cava. All blood from the umbilical vein enters the inferior vena cava, where it mixes with the venous blood flowing through the inferior vena cava from the lower half of the fetal body. Mixed blood flows through the inferior vena cava into right atrium. From the right atrium, it is directed by the valve of the inferior vena cava, valvula vena cava inferioris, through the foramen ovale into the left atrium. From the left atrium, mixed blood enters the left ventricle. In the addition to the inferior vena cava, the superior vena cava and the coronary sinus of the heart also flow into the right atrium. Venous blood entering the superior vena cava from the upper half of the body then enters the right ventricles, from the latter into the pulmonary trunk. However, because the lungs are not yet functioning as a respiratory organ, only a small part of the blood enters into the lung parenchyma. From there, through the ductus arteriosus, the descending aorta, from there to the viscera and the lower extremities. In the small pelvis, the umbilical artery, arteria umbilicalis, departs from the internal iliac artery and the internal abdominal wall of the right umbilical arteries are located on the sides of the bladder, and approaching at its apex through the umbilical foramen enters the umbilical cord and reaches the placenta. Following changes occur into the vascular system of the newborn. The umbilical vein, after the ligation of the umbilical cord, is partially obliterated and it turns into a round ligament of the liver. The Eccrinian duct connecting the umbilical vein and with the inferior genital vein in the fetus also obliterated afterward, turns into the venous ligaments. The arterial duct of the or bottle duct connecting the pulmonary trunk with the aorta is obliterated and turns into an arterial ligaments. The oval window by the end of 1 year of the life should overgrow and it turns into the oval fossa. The umbilical artery lying in the medial umbilical folds on the arterial wall of the abdomen, functioning throughout their entire life. Only in the fetus. In the adult, only the initial section of the function of the from which upper urinary arteries depart, then they lie in the plica umbilicalis medialis from the medial umbilical fold.